So let's jump right into um, this program in Abnormal Psych and just review a little bit about um, the history of psychology. First of all, of course, the definition is that psychology is a systematic scientific study of behavior, experience, and mental life. So that's kind of important to at least be on the same page for that. People that practice psychology are, of course, psychotherapists, which is a term that includes anyone that does talk therapy. Clinical psychologists either have a PhD in EDD or a PsyD, and they do the bulk of things like assessment and other higher level psychological things. Counseling psychologists essentially do the same things. One focuses more on mental health issues. That would be the clinical. Counseling psychologists are said to do things like problems with normal development. We can talk more about this in the Zoom meeting if you have questions. Psychiatrists, of course, are physicians at first off, and they do most of the medical treatments. Although in some states like Nebraska and Texas that are large and really spread out, some psychologists do medical treatments like prescribing medications, but those are few and far between. Oddly enough, they're probably people that have the least amount of mental health training. Psychoanalysts are people that can be either a psychologist or a psychiatrist who are trained in Freudian approach, the psychodynamic approach. Mental health therapists who have what's called an LCPC license, have a master's degree in outpatient clinics, do about 90% of the work. Social workers, of course, are trained in social work, and they have what's called an LCSW, licensed clinical social worker. They work in a variety of settings, including things like schools, so that's an option if any of you are interested in that and don't want really to work in a clinic, but more work with kids. Mental health technicians, of course, are counselors with a bachelor's degree. They do entry-level work. This includes things like intakes and helping co-facilitate groups. There are nurses that have anywhere from an associate's to a PhD, and they do, of course, nursing care, mostly inpatient settings. And then, of course, there's a variety of allied health people like music and art therapists, recreation therapists, speech, occupational, and physical therapy. So there's lots of opportunities to get care. One I neglected to put on here is called the CADC, or Certified Alcohol and Drug Counselor. You can get an MACDC, which is just a more advanced form of that. It requires a bachelor's degree and 500 hours of supervision. Master's requires 2,000 hours of supervision and a master's degree. So if that's something that interests you, you can get a job at like Sheridan or some other facility that where you work as a substance abuse counselor. The history of psychology is long. When I was in graduate school at Washington University, I took a course solely on the history of psychology, and quite fascinating. So essentially, it's divided into eras. One era is called antiquity, which of course includes the whole idea of demonology, that problems evolve because of spirits in the world. There's somatogenesis, which is, of course, that mental illness results from some physical cause, which oddly enough started back in antiquity and really resurfaced during the 20th century. And psychogenesis, which is really kind of the seed for psychodynamic theory, which basically says there's something wrong with your mind, whatever that is. The second era is called the Dark Ages and the Scientific Revolution. It's a period of stagnation in which the world was run basically on the principles of the teachings of the church, and science stagnated. The scientific revolution followed the Dark Ages, which was the growth of the Age of Enlightenment. During the Dark Ages, there were persecution of witches, and of course the growth of asylums, which again we can talk about in the Zoom meeting if you want to attend. Some of the early psychiatrists during this early period, the second period of the Dark Age and Scientific Revolution, included Benjamin Rush, who practiced bloodletting. He actually was the personal doctor of George Washington. Philip Pinel, who encouraged the humane treatment of inmates or patients. Often this was only sort of like going through the motions because people didn't get better, partly because they were treated as if they were still some stigma attached to it. And then, of course, it was often limited to people who had wealth. The moral treatment took over in England. William Tuke, a Quaker, established the York Retreat, in which the treatment of mentally ill people was through work in aesthetics, painting, making birdhouses. The problem with this, and of course this happened on this side of the Atlantic too, at the Hartford Retreat in Hartford, Connecticut, was that there was no active treatment going on. Basically, people were at Club Med, in a sense, for the time, but didn't get anything that actually helped them get better. Outcomes of the retreats were poor. And then it wasn't until the late 1800s that Dorothea Dix came along and established in the United States the state hospital system. 32 state hospitals between the Atlantic seaboard and just about the Mississippi River. Interestingly enough, Illinois actually had one of these hospitals down in Peoria. It was called Peoria State Hospital. It's since been torn down. If you're interested, you can go on the internet and look at some of these. I actually saw the very first one called the Dorothea Dix State Hospital in Raleigh-Durham, North Carolina. It's fascinating. And this people started treating mentally ill people as if they had some actual illness. Early classification systems that were not anywhere near what the DSM-5 is included William Emil Kraepelin's system of classification. It had two major groups: dementia praecox, which today we call schizophrenia, and manic depression, which of course we call bipolar disorder. There are over 500 diagnoses, by the way, in the DSM-5. In 1825, Greisinger was the first person to show that this mental illness was caused actually by a biological condition when a person gets a syphilis infection, easily treated. And then, of course, Pasteur's germ theory was the foundation of most modern medicine. Psychogenesis reemerged during this time period, including the works of Franz Anton Mesmer, one of the real famous hypnotists who believed that there were magnetic fields around the body. Many people at the time thought he was kind of a quack. He may have been. In fact, there was an international commission dedicated to scientifically studying his claims, and it was led by none other than Benjamin Franklin. But given the time period that they lived in, there was no way to prove nor disprove his claims. Jean Charcot was another interesting character who studied hysteria and used hypnosis to get to the roots of things. Joseph Brauer developed the cathartic method, which basically means talking about your feelings, which was followed closely by Sigmund Freud, a protege of Brauer's, who basically established the modern era of mental health care. The early era of psychology was the third period, so there was antiquity, the scientific revolution and dark ages, and the early era. This was basically the launching off point between non-psychology and psychology. So both Wundt and Titchener and William James on the next slide were not psychologists, but at some point they changed their office designation from the Department of Biology in Wundt's case to the Department of Psychology. So Wundt basically practiced what's called structuralism, which basically says that the mind is made up of what he called mental corpuscles, which is far different than James's approach. which is called functionalism. It says basically it's not what you have, but how your mind uses what you have. He was a philosopher at Harvard, um, and went on to basically lay the groundwork for modern neuroscience today, uh, and may be one of the most interesting and underappreciated psychologists in American history. Which leads to the modern era. So there are 5 paradigms. Now, the difference between a paradigm and a model is that paradigms are useful ways of dealing with problems. Models are overarching structures that we try to either support or disprove. The first one, of course, was Freud's psychodynamic or psychoanalytic theory in the 1890s. It basically says, as you know, that unconscious forces determine human behavior. The problem with this approach is that it's a deterministic model that says basically that you are what's happened to you in the past, and therefore it's out of your control. And the other issue is that it's not falsifiable. So how do you prove nor disprove this theory? The second approach happened on this side of the Atlantic, called behaviorism. In the 1920s and 30s, people like William B.F. Skinner, John Watson, and of course Ivan Pavlov basically say that we are what we've been reinforced to be. So we learn our behaviors. It hit its peak in the 1950s and is probably one of the most user-friendly approaches. Unfortunately, this is also a deterministic model. So things might be out of your awareness that you've been rewarded for, that you've had no necessarily knowledge of. The third school is not deterministic, and it's called humanism. So humanistic psychology emphasizes free will and making choices. Very different than both psychodynamic and behaviorism. You can further subdivide humanistic psychology into different schools, including humanistic psychology itself, with Harry Sullivan and Abraham Maslow, but probably the most famous of all American psychologists and most influential was someone you may have never heard of, and that's Carl Rogers. He called his approach client-centered, patient-centered, student-centered, etc. There are many names for it, but basically it accepts people for where they're at, recognizing them with unconditional positive regard, empathy, and acceptance. In Freud's day, he talked to his patients by sitting behind them and letting them talk. Carl Rogers basically emphasized the importance of a relationship with the client, so he pulled the chair in front and actually talked with them. There were the Gestalt psychologists who emphasized the total perception of a situation, including Wolfgang Kohler, Max Wertheimer, and Fritz Perls. And of course the existential psychologists, which again we can talk more about in a Zoom meeting, that emphasize issues of existence, particularly death, finding meaning in life, responsibility and freedom, loneliness and isolation. And they include Viktor Frankl, John Paul Sartre, Soren Kierkegaard, and a more contemporary psychoanalytic existentialist called Irvin Yalom. The last 2 schools include cognitive psychology, which basically doesn't emphasize learning as much as it emphasizes mental activities. Interestingly enough, this all came about during the evolution of computers for the public, and in the 1970s, people likened the mind to a computer. More recently, cognitive psychology and behavioral psychology have teamed up to develop what's called a cognitive behavioral approach, which emphasizes both learning and thinking. And of course, the last school is the School of Neuroscience, which basically says that people are what the accumulation of their physicality, especially the nervous system, makes them. So, and we can talk more about this, and we will talk more about this during some of the segments, especially for things like anxiety and depression. But you're probably all wondering about models. So when you do some of the reading and some of the viewing on YouTube in the course material, you'll notice that these four cover pretty much everything. So one model is called the spiritual model. It basically says that the root of mental illness is demonic possession. And of course, if some spirit is dictating your behavior, the treatment for the spirit possession is to get exercised. Obviously, most people don't subscribe to this model. A second model is called the social standards model. And basically, it suggests that we develop what's mentally ill based on what the consensus of society decides. So if you were to disrobe and run through town or across campus, you probably would get arrested because it's considered a violation of a social standard. If you were on a nudist colony and people were disrobed and you had your clothes on, you would be considered deviant. So that's an interesting way of looking at it. If you look back at the early DSMs, the 1 and 2, homosexuality was considered a mental illness. It's no longer because society has deemed it not to be. And we'll talk a little bit about that in the Zoom meeting, and we can talk a little bit about some people like Thomas Szasz, who basically say that mental illness is a social construct. There's the statistical model, which says that basically mental illness is defined on how often it occurs. So, for example, most people feel sad and cry once in a while, but most people would probably say that that's not a mental illness if you cry because, for whatever reason. But how about if you cry all the time or are anxious all the time? So you can define, statistically speaking, mental illness by its occurrence or frequency. And of course, the last model is called the medical model. This is the one that's currently being used. And it basically says that mental illness is caused by a pathogen. That's why when we talk about the DSM, you'll notice that they have a diagnosis, the symptoms, and etiology, which is the cause of a problem, its treatments, and prognosis. Those all would be, you could interchange depression with a, tsetse fly infection or irritable bowel syndrome. So that's an overview, just a quick overview. And we'll talk more about this in the Zoom meeting, and we can answer some of your questions because I know this will be on in some of the first assignment.